Good morning, folks. Good evening, folks. Welcome to the Saturday noon hour with the US India Political Action Committee and the Imagine India Institute. My name is Robinder Sachdev. For the past almost a year now, we've been holding a series of weekly or fortnightly showbinars, as we call them, or discussions with the Indian American community on topics of interest within the United States or on US India relations. And of course, over the past few months, we were also discussing a lot about American politics or US elections and the results thereof. This Saturday, the topic that we are working on, and we've got an eminent and a brilliant panel with us to discuss, is something which has been, which has cast a dark cloud over our lives wherever in the world we may be. The question of the day today is India's COVID-19 crisis. Could the second wave have been prevented? This is a discussion. There's absolutely everything is unknown about this COVID menace that we are facing, but still, can we attempt to make an analysis of the second wave, which is right now roiling India? That said, now, may I invite to the panel with me my esteemed colleagues who will be joining us. And now, folks, remember, this is Facebook Live on the US India Political Action Committee Facebook page, as well as the Imagine India Facebook page. So please keep your questions coming, and I'm sure our panel will be more than happy to weave in your question into their answers. They will not interrupt their discussion what they're doing, but we will share your question with them. So any question that you have, please do absolutely feel welcome to share with us. May I welcome now our panel with us. First of all, Sanjay Puri, the founder chairman of the US India Political Action Committee. Welcome, Sanjay.
Thank you, Robin.
Thank you so much. Next, may I invite Mr. Jeremy Carmel, Dr. Jeremy Carmel, who would be with us. Then he's Associate Professor of Microbiology and Immunology at the LSU Health System. Welcome, Dr. Jeremy.
Thank you very much for having me.
Next, may I invite Dr. Medalini Darswal. She is a PhD candidate at the Harvard University at the School of Public Health. She is also a civil servant in India on a sabbatical. So I think her experience of what she's learning here, combined with the government service that she's been into in India in the past, and going forward, what she will do would be a very interesting nuance and perspective to hear from her. Good morning, Dr. Darswal, and welcome to the show, please.
Good morning, and thank you for having me today.
My pleasure. Next, may I invite Dr. Vipin Garg. He is the founder, CEO of Altimmune. Dr. Garg is a serial entrepreneur. He's led several companies, taken them public, IPO itself. So serial entrepreneur, and right now he's working on another approach, a nasal spray to prevent COVID. And we've had the pleasure of having him earlier also in our discussion. And this time around, we of course look forward to hear his views on the COVID crisis in India, but also to learn some of his research work which he's working on. Thank you so much, Dr. Garg, for joining us. A pleasure to have you, sir.
Yes, good afternoon. Thank you for having me. It's my pleasure to be here.
And his daughter is graduating from Duke today, so hearty congratulations from all of us on the panel here to her and from our audience.
Thank you.
Pleasure. Now, may I invite Sanjay for the opening remarks. Okay, the format would be, as we all know, and for the sake of our viewers, we'll go in rounds. The first round would be opening comments by each speaker. Especially with Sanjay, I would like to know from you, last week, the US India Political Action Committee had some meetings with some officials and on the Capitol Hill regarding the COVID crisis in India. Could you please share with us what you've learned? What are the trend lines that you're seeing? Sanjay, your opening thoughts along those lines, please.
Thanks, Rabinder, and thanks to our esteemed panelists. Very, very impressive. I'm really hoping to learn from them. I think we all, whether you're of Indian origin or just not, we are aware of the crisis in India, which is really relevant to what we do in the United States as an organization, USINPAC, which has been around for 20 years, working on behalf of the Indian American community. This is something our members really feel personally. Every Indian American, at least the ones that I know, that thousands who reached out to us have some family or friends who are impacted by this. And there are some larger geopolitical as well as other ramifications. So we've had multiple discussions, Rabinder. Last week was one of the many. We had discussions with the co-chair of the India caucus and several other members of Congress, as well as there were members from the administration, CDC, State Department, and other agencies. And I think what we were trying to get an assessment is what is the different branches of the U.S. government doing? Is there a level? What is the level of coordination? And it was pretty helpful to see, especially USAID as one of the lead agencies, the amount of effort, the amount of commitment that is happening in terms of doing that. And we had several questions, and again, I'll also hope some of the members of the panel can talk about, because a lot of leaders in India are asking, when will the vaccines that have been committed by the President Biden be actually released? Is there a timeline? And whatever proportion of that would be for India, as well as the vaccine materials. So those were some of the questions that we had for the members. I had follow-on discussion actually for a member of Congress that WIPIN is represented by Congresswoman Deborah Ross. So we are following up on all those things. So Ravinder, it's we are making a lot of progress. There is a lot of seriousness with this administration about this crisis. Thanks, Ravinder.
Thank you so much, Sanjay. Yes, sure. I mean, so I really wanted us to hear, and the panel, and of course our audiences, what some of the takeaways were from the meetings that you had last week on the Hill. Thank you so much, Sanjay, for sharing. May I now invite Dr. Jeremy Kamil for your opening thoughts on the topic of the day today, the COVID crisis in India. Was the second wave, I mean, could the second wave have been prevented? You can please take the topic anyway you would like to share your thoughts on, Dr. Kamil.
Well, I think if you look around the world, it's clear. I don't want to speak just of India, but a lot of countries could have done a better job. But hindsight's always 2020. It's a long time. It's been a long pandemic. I think there's always pressures to open the economy, to open businesses, and to go back to the things that we're used to, which is enjoying time with our families indoors, not wearing masks. And I think, unfortunately, India got caught by surprise. And also, unfortunately, in India, there's been influencers from the United States, from other countries, saying things like that the Indian people are genetically resistant to coronavirus because the wave didn't show up when they expected it to. And I think it's just a tragedy of misinformation and people taking bad advice and letting their guard down, because it's hard for any of us humans to understand exponential growth. Because it's like a wildfire growing from a few little pieces of smoke in the air, and all of a sudden it's a blazing inferno. And I think that's exactly what we've seen happen in India. So I would say, yes, it could have been prevented, but it would have taken sustained focus and better communication from a lot of people, not just the government, but also just society. And hopefully we learn an important lesson here, because all these lives lost and suffering, yes, we could have probably made it less. I don't know if we could have prevented it completely, but clearly with just simply following masking and putting the energy where it matters. So do you really need to wear a mask outside all the time? Maybe not, but you should very, very, very much be careful about crowding indoors in poorly ventilated areas. Those kind of lessons are very important, and we keep learning the lesson again and again the hard way. So hopefully we will be in a better place the next time there's a pandemic, or at least to crush this one while we still have a chance to. Well, I think you're on mute. Sorry.
Sorry, I was on mute. Thank you so much, Dr. Jeremy. Of course, yes, hindsight at times is 2020. And given the context of this pandemic, which is unprecedented, something which humanity has never seen before, we are maybe kind of just figuring our way across or out of it. But at the same time, yes, there could have been some aspects, generally speaking, which could have, if not prevented, but reduced the impact of this pandemic actually. But anyway, we will dive or dig deeper into that in the subsequent rounds. Thank you so much, sir. May I now invite Dr. Mrinali Darswal for your opening comments on the topic, please. Dr. Darswal, your comments on the topic: could the second wave in India have been prevented? And especially, I think it'll be interesting for us all and for the viewers to understand, to hear your perspective, because you do have a deep understanding of the Indian administrative machineries. Please, your thoughts.
Thank you. I've been working as a civil servant for the past 20 years. 15 of those have been spent in like relatively rural areas in the field. Um, I totally agree with Dr. Kamil when he says that we have not reached a stage where we could prevent new waves anywhere in the world. And I would also not say that we as a nation were ill prepared for the second wave, but I would definitely say that we were blindsided by the speed and ferocity of the infections of the new variant. The steep, almost vertical line of infections over the past month is fear causing and distressing. And we've been seeing, we are all familiar with the visuals of critical care wards in hospitals, etc. But what we do not see and what is not covered because it is like kind of boring in the media is how the government works behind the scenes in such situations. The leaders and administrators in India, many of them my colleagues, have been working day and night for the past 1 year, looking forward to such an eventuality. But like I said, we were preparing for more waves because the world was facing so other countries were facing so many waves. So we were not like, we will not get, another attack of COVID infections or anything like that. But the ferocity, the scale, the speed, was something which was a bit difficult for us to tackle immediately. But what we have done is our achievement is we vaccinated our frontline workers and medical staff. And you have seen in the past 2 or 3 years how they have stood fast and served the nation untiringly day and night. And that was because we were ahead in vaccinating all of them in time. And there have been very unfortunate mortalities, but this could have been much worse in the absence of vaccination. We see that there is no run on PPE, masks, and other critical supplies this time, except for oxygen. And we had ramped up our oxygen capacity 10-fold from 700 metric tons to 10,000 metric tons. But the logistic of transferring oxygen to hospitals which demand it is very technical. But then we did it very fast, and now oxygen is reaching everywhere where it is needed. And now we see, although the speed of infections going up was very, very fast, the curve is now bending down equally fast. And today's results in Delhi and Mumbai are giving us infection rates of less than 5%. And these rates were more than 30% in April when the wave started. So we have done some good things. We are still in the firefighting mode. Dr. Kamil said it is now a big inferno, but I'm very sure that we will be out of it sooner than expected. And on the second point, that world was conjecturing on inherent immunity of Indians and why did we not get so affected in the first wave. I want to caution everybody, similar kind of statements are now being made from Malaysia and Thailand and Southeast Asia. So I would like to caution all of these areas which have not seen, a bad wave so far, not to let their guard down. And regarding collaboration with US, there is a lot to do here. Two of the biggest democracies. We'll discuss that as we go forward in this discussion. Thank you.
Thank you so much, Dr. Medani. Of course, in addition to the point that Dr. Jeremy made about, the public health infrastructure and again, hindsight 2020, and, it's the first time everyone is kind of moving in this area. But what you mentioned also is interesting point that the government or the governments anywhere in the world, actually, there's a lot which goes on behind the scenes, of course, to which, the publics are generally not privy to. And as you said, that your colleagues in the Indian government have been working day and night and very hard on this. Absolutely there. But at the same time, you see, not knowing what's happening also raises, if not questions, we are left in doubt as to what is out there. So better communication itself, as Dr. Kamil also said, and as you also saying, are also one aspect of, handling this pandemic. Thank you so much for your thoughts. And we will definitely get into more aspects, including US-India collaboration in healthcare as such. May I now invite Dr. Vipin Garg, President and CEO of Alt Immune, for his thoughts on the topic. Now, Dr. Garg, you come as an entrepreneur, right? We had Dr. Dr. Kamil, let's say, as an academic, as a researcher, of course. Dr. Medalni as a researcher, but at the same time as an administrator also, right? So now you're coming in as an entrepreneur. So what are your thoughts on the topic of the day, that could India's second wave have been prevented?
Yes, thank you, Robinder. Some excellent points have been made by both of my fellow panelists. So rather than repeat those points, I would simply say that as far as the second wave is concerned, as we know, we have seen second wave in many countries. So India is not alone. I think the timing for India could not have been worse. The vaccination hadn't reached many people in India, and there was a sense of relief. There was a sense of that perhaps we have passed the worst possible time, and people sort of let their guard down. And then the virus came back with a vengeance. What was happening perhaps in the population, that the first wave of virus was still kind of incubating. And if you let the virus replicate, it will mutate. We know that about viruses. And that really what caught everybody off guard, that the virus mutated and then it came back with a vengeance. And I think the question I want to focus on, well, so what factors might have led to that? First of all, the characteristics of the virus itself. If you look at the variant that's causing havoc in India right now, we know that it's more transmissible. It also has longer duration of infection, and which means more shedding, more opportunity for shedding. So all those three factors combined really fueled this fire. You also have to look at the characteristics of the population. India has a large population, very dense population, and still majority of the people have no prior infection or vaccination, so that further exacerbates the situation. Then you layer on top of that the socio-cultural conditions and infrastructure. You have a recipe for this major outbreak of the virus. So I think I would say that it was a perfect storm in terms of bringing all these factors at the wrong time, at the right time from virus's perspective, but at the wrong time from human perspective, where we just didn't, there just wasn't enough vaccine to vaccinate everybody, and the virus took hold and was able to replicate as a new variant. So the question is, what have we learned from that? And I'm sure we'll talk more about it. And how do we combat it? And how do we make sure that we can control the virus, stop it in its tracks? And where do we need to make more investments to make that happen?
Thank you so much, Dr. Garg. Yes, we shall dig into it deeper, and then in subsequent rounds, we would also like to know about, your innovation that you're developing as a treatment for the COVID scenario. Meanwhile, we do have some comments coming in. Viewers are watching in, folks. Please keep in your questions coming, and we'll try to get them to our speakers. There's Vikram Slathia saying, Dr. Daswal, don't you think getting COVID vaccination will be a regular phenomenon in coming years? Thank you so much, Vikram, for your question. And I'm sure that Dr. Mirnalini will keep this question in mind when she's making her remarks. We also have some comments coming in from Sneh Kalgotra, from Subhash Chandra Pandey, giving a thumbs up like. Thank you so much for your likes, folks. Likes are always welcome, but what we also more welcome are questions, because then we can draw out the ideas from this brain trust that we have with us today at this hour to discuss on this topic of the day today. Now, moving on to the second round, please. In the second round, the question overall is that I think our panel has started to touch on that other than India, globally, where all have we seen second waves so far? And what were some of the lessons from the second waves in some of the countries? Now, Sanjay, may I ask you, in the context of this question, what is your perspective from the US administration or US policy perspective with regards to India? What do you see? And again, I'm trying to draw you out from your conversations of last week. Where do you see the US administration, the US government, the US policymakers, lawmakers kind of stepping forth with respect to India?
I think, Ravinder, there is a pretty high-level engagement there. I mean, whether it's CDC, whether it's USAID, whether it's HHS, State Department, this is a priority for them, at least the conversations we had. It's not just in the equipment that they're giving, but it is one of the things that we emphasized, at least in my conversations, that there are lessons learned in the United States. We have been through what India is going through in some ways. We've been at the receiving end of all of this, and it involves, whether it involves vaccination, whether it involves, public messaging. We've been through it all, where there's United States is a country where almost 30-40% of the people are hesitant about vaccinations. There are people that still believe that there are microchips in vaccinations, etc. So there is stuff that can be done, that we are learning. We had supply chain problems in this country that most people forget a year ago, when we had PPP and all kinds of other stuff that was hard to get. FEMA was sending in planes to China and other places to bring that stuff. And, we were talking about the supply chain issues for oxygen concentrators and others. So I think it's not just equipment that we are looking for from United States. Yes, vaccines would be great, vaccine raw materials would be great, but it is, are there lessons learned after dealing with this, and hopefully turning the corner here? And so it's supply chains. It's also, there is a lot of fraud going on in India, Ravinder. When you look at stuff like medicines, I mean, it's shocking to see that there is fraud of medicines in such a crisis time. So using technology to make sure those things don't happen. So those are the conversations we are having with them, and also asking them, what else can we do? There's a doctors network that has been requested by some leading business folks that can provide support to them. So we are looking at doing a lot of those things, and I think there's a serious level of engagement in there.
Thank you so much, Sanjay, for your comments. And as you were speaking, we do have more viewers who are pitching in with their likes or comments. We have a comment from Uday Sachan. His comment is, the US can take a small portion for vaccination of India. It may energize the whole country and relations also. Thank you so much, Uday, for your comment. Now, we also have a comment from Dr. Suresh Gupta coming in, and from Achal Patel coming in. Dr. Suresh Gupta is saying, a bad question for a panel discussion. Could second wave have been prevented? Of course, you need to address what went wrong, where it went wrong, who did not listen and who did not mandate, what happened to the experts' advice. Thank you so much, Dr. Gupta. Absolutely, yes. I mean, what we are doing is opening the question to an open house, and whichever perspective our analysts or expert speakers come up, that's what we would love to know. And it's sharing at this point, sharing and learning and moving on. I think that's what we're looking at. We have a comment from Achal Patel also. Indian media is highlighting the third wave too much. Does the panel feel that even after current vaccination drive and second wave, there would be a third wave even worse? Thank you so much, Achal Patel. I think that would be a question will coming in. We have two more questions also coming in. We'll take them in a while, but let me move on to now Dr. Jeremy Kamel. Dr. Kamel, the second round question overall, yes, again, still second wave in other countries. What has been the experience of other countries? Lessons learned. And why is the second wave in India so lethal?
Well, I think it's been mentioned by Dr. Garg and the other panelists as well. I mean, the reason the second wave is so tough in India, I would put the main drivers as crowded population. India is a very populous country, and that's one of the reasons it's so successful at so many things in industry and education. I mean, India produces some of the brightest minds there are, because you have a giant population. But that's also a vulnerability when you get to pandemics, because people live very crowded, very tight, have big families, big gatherings, big religious events. And unfortunately, all of these pandemics, I mean, you can point to the variants, and I think that the B.1.617.2 does seem to be a highly transmissible variant, and that's certainly going to contribute to the pandemic. But the number one driver in all these countries of the second waves or the third waves is human behavior. That's the thing that we can control as individuals. So I think one of your questions that came in from your audience was, well, is the third wave going to be even worse? Well, I would put that back to all of us. The future is something we can control. We cannot change the past. But each of us as individuals will make a decision that decides our fate as a country, as a nation, as a world. So what we can do tomorrow in terms of remembering to wear masks when we're mixing indoors with people we don't live with, there's very simple lessons. Believing the virus is real and not a conspiracy of the government to control you. Someone mentioned misinformation earlier about should people think there's, in the United States, there's like 30 or 40% of people who think there's microchips in the vaccines, or that you shed the vaccine. These are indications of education that is broken, critical thinking that is broken, and also people confuse zombie movies with reality. So I don't know how you defeat that. I don't know how you defeat misinformation, but whatever you can do to be logical and reasonable and put out simple guidelines, repeat the same logical things, because no one wants to see their loved one become sick. No one wants to see their friend suffering and needing oxygen, because you don't want to find out a virus is real the hard way. So yes, I really much think that the third wave can be controlled with vaccination and just simple messaging. I would rather people be a little bit too cautious. Open up your economy once you get case numbers down, but try to wear masks when you mix indoors for, unfortunately, the foreseeable future in terms of the next months and maybe even the next year, because we just want to get out of this pandemic and get the economies running well again and get healthy again, and then we can drop all those practices.
Thank you so much, Dr. Jeremy. You made a few points, but I think the one word or phrase which you mentioned captures a lot: human behavior. That the second wave or the third wave, whichever it be, human behavior can help us mitigate whatever the impact of whichever wave we are going to be facing in the coming future. As you were talking, we do have a lot of people commenting. Thank you, folks, for your participation. I'll quickly read out some of the questions which were there. Achal Patel, we've taken already. Rajiv said that, what are political implications for the Modi government over its handling of this crisis? Thank you, Rajiv, but this is not a political discussion right now. We are focusing more on other aspects, the political implications. We leave it to the political experts to analyze. Thank you for your thought. Anything related to the context at hand, you're very much welcome. JP Jagdev says, Dr. Mrinalini, how do you think the government of India is going to treat this experience as one-off and let it pass, or do something tangible about the public healthcare system? Thank you, Mr. Jagdev. We have another question or a comment coming in from Shobha Kumar. She's saying, I think this kind of ties in with what Dr. Jeremy is saying. In terms of communication and awareness raising, it would be very helpful if India immediately makes available an influential and respected health spokesperson doctor who becomes the face for combating COVID in India, somewhat very similar to Dr. Fauci in the US, who can communicate a clear message on the importance of the vaccine, etc. She also goes on to say people are truly feeling abandoned and at open sea without any clear guidance or support from the government. Thank you so much, Shobha. And I think this is a very relevant question heading into Dr. Mrinalini, because she does have experience or some background of the administrative machineries. In the context of these questions, but stepping back, your overall thoughts on the question in this round, that could the experience of second waves in other countries, why is the second wave in India so lethal? And then, of course, you have these questions and comments which are coming in from our participants. Dr. Mrinalini, your thoughts, please.
Thank you. There were a lot of very pertinent questions, and I'm really hoping that I'm able to hold those in my mind together and answer all of those. First, to the question of this round, what are the lessons we have learned? I would say that India has learned lessons from other countries, but we have learned lessons from our first wave, and those are kind of emulative. You see, there is an acknowledgement in India that vaccination is the way to go, and we have to reach the shots in the arms as soon as possible. And I was reading like today's Indian government's bulletin, and they have a plan in place of vaccinating everybody in the country by end of this year, and month-wise vaccination procurement targets. And also the orders they have placed, they're all out in the open, in the public space to actually see and know that we are serious about vaccinating our population. And another thing, India, like when it is an endemic, only a country is suffering, it is a very good policy to be inward looking and just taking care of your own population. India did not do that. India understood that this is a pandemic and nobody is safe until everybody else is. So India has been a very active participant in COVAX and reaching out, vaccines to other countries from the very beginning. And unfortunately, that had to be stopped because now India was becoming the center of, kind of spread of the infection, which we do not absolutely want. And therefore, we have to ramp up our own vaccination drive so that the entire world is safe when, India is safe. And regarding communication, I would not say that government has not been communicating. Only problem is the containment of this virus when we take human behaviors into consideration is on the simpler side, and people want something dramatic to be communicated, but this virus can be contained by simple measures like wearing a mask, not going outside unless absolutely necessary, maintaining social distancing, like Dr. Kamil said. But human behavior compliance takes a very heavy cost in livelihoods. And India is not a nation that can stay indoors for very long periods of time and then they can sustain for years on government help. Like US can afford to do that, but we need to work to move the country forward. So that being said, I think the more useful approach is where there is less compliance required of people who must work, and there is more of a containment strategy, like more allowance of working from home by the companies, no furloughs and layoffs for a certain period of time, and maybe the companies are compensated for doing that, through tax or something, and other behaviors which are less, impinge less on individuals, but are at a community level. And another lesson we learned was that we are going to decentralize vaccine procurement because we were very successful in testing by decentralization of testing. India is doing maximum number of tests in a day, 20 million tests in a day, because that were decentralized very early. So we have done the same thing with vaccination, and now states are also placing orders as per their context and their requirements. So that is another thing we have done. Fourth thing that we have done is now we have authorized RATs, that is rapid antigen testing, and the test is already in the market and its rates have been fixed. The software has been delivered to the people, and those are like $1 per test kind of tests, which are now being made available. So all of these things, other countries took a long time to implement all of these things together. And India has this advantage of, having learned from its own experience of COVID as well as other countries. And we are now putting together everything, every thread together to weave the tapestry of, containment of virus in the country. And you are seeing results in, climbing down of the infection rates, positivity rates, as well as the number of infections and hospitalizations. Look at Mumbai, like, it's very well on its way to, coming down to like very low levels of infection, and so is Delhi. It's like going down on a daily basis. Thank you.
Thank you so much, Dr. Daswal, for your thoughts. I mean, I think, yes, of course, we do relate, and absolutely, as you laid out the context of the best efforts of the government in India and the administrative machinery. However, that doesn't take away, as we would also appreciate, the fact that there are lots and lots of questions about the speed and pace of India's vaccination program, India's procurement of vaccines. There's a lot of, confusion, in fact, if one could say, about India's vaccine procurement policy. Though the central government may say that they have a clear-cut idea of what they're doing, but on the ground, maybe there's a gap in communication, or maybe there's a gap in the actual policy itself, that the vaccine procurement, because as you see right now, in fact, the vaccination rates are coming down. Right now, I mean, we are not able to have vaccines delivered. Why, what, etc. So those are questions and challenges which are out there. Thank you so much.
Yeah, if you allow, I'll just say a few lines on, because this is a very, very a valid question and a critical discussion that is going on.
Yes, it's a critical analysis.
Yeah.
Yes.
You remember when, the vaccines were being developed, Serum Institute was the only one that took that gamble and actually produce 50 to 60 million doses of vaccine in advance. And those were the doses that were actually released to the market, and India started, having vaccination. We could vaccinate 180 million people using those doses and the additional supplies that came in. But like we have understood today in today's discussion, that we were completely blindsided. There was a plan in place taking into consideration the earlier infection rates. But we did not know that we will be struck by this second wave, which is going to be like so deadly. And we needed to ramp up vaccination very, very fast, which we are going to do. But what do we do when we are not getting the bags, we are not getting the filters? Serum Institute can produce 170 million doses. It's not even able to, produce half of that. So it's not that we are not ready. It is that now supplies are choking up. And that is exactly where we need help in opening up of all these raw material supply chains so that we are able to produce the vaccines which we require. And we can do it at a lightning speed, and we have already proven that over the last 1 year.
Sure. No, thank you so much. I appreciate it. Before I come to Dr. Garg, there's some more comments coming in. I'll just quickly read them out. Vikram Slathia is saying, okay, Dr. Suresh Gupta had a question. What was the idea, theory, the rationale of the vaccine Maitri of the government of India? Dr. Gupta, that's indirectly being kind of addressed in this question right now. We'll come to it maybe a bit later. Vikram Slathia says, to break the virus chain, do we need simultaneous administration and nasal vaccination, because wearing masks for longer period is becoming difficult, especially for asthmatics? Mrs. Vikram, your question is very interesting, because I think we would also then welcome Dr. Garg's view. You can take about a minute to tell us about your particular approach to nasal medication that you're developing, Dr. Garg. But before that, if you could throw some light on this topic that we have right now, the second wave, why is it more lethal in India? What could we have had learned? And as Dr. Mirnali says, sure, we were all blindsided. But isn't that what future planning is to some extent, which could have mitigated or reduced those risks? What are the learnings from other countries so far, so that we can be better prepared for the future now? Dr. Garg.
So, thank you. So a number of very good points have been made. I won't go into the human behavior. I mean, we all understand that it's critical to, our behavior is something we can control and we can change and we can really influence the virus. But I think beyond that, let me just make a comment on manufacturing. There is and this is a global issue. This is not just an Indian issue. There just isn't enough manufacturing capacity for all the vaccine that we need in the world. The challenge with manufacturing is you can't build a facility in a few months. So basically, every facility, every manufacturing plant that we have available around the world is producing vaccines. And hopefully we're going to build more plants. One thing we have learned from this, that we can't be complacent as a society and on global level. We have to figure out how to have enough manufacturing capacity available. We may not need it all the time, but we still need to have it ready, because it's too late. You can't build a new plant in less than 12 months or 18 months in most cases. So you can't really help the situation by building new plant right now. We've got to build more capacity for the future right now. So when the next pandemic comes, which it will, we are ready. We are better prepared than we were this time. And I think India will and can play a major role in that, because again, from a manufacturing perspective, India can manufacture any of the pharmaceutical products and has had a track record of manufacturing vaccines. So that's something to look forward to in terms of future. But I think the other thing I would add is that in addition to human behavior, we also have to continue to do good science. We've got to continue to understand what these variants are doing, how they're changing. How do we stop them from new variants to be generated? So one of the issue is that if you let the virus replicate, it will mutate. That's how viruses work. If you can stop the replication, it will stop mutation. So the key here is to figure out, in sort of new technologies, to figure out ways to block the transmission of the virus. So that's one of the things we're working on. Our vaccine is intranasal. The idea is that you're delivering the vaccine to the site of infection. So not only you're blocking the entry of the virus, which is important, you're also blocking the exit of the virus. So even if you get infected, it'll block transmission, and that's very important because virus is always looking for new hosts, and that's how it multiplies and that's how it replicates. So we can't forget that we've got to build manufacturing capacity, but we also have to continue to invest in new technologies that would be helpful for this virus, for this pandemic, and also for future pandemics. So I think, I would just add that on top, that we can't forget the science, and we have to continue to invest in science and manufacturing technologies so we can be better prepared next time.
Thank you so much, Dr. Garg, for your thoughts and comments. Of course, yes, I mean, the science, human behavior and the science, and maybe the third pillar then is the overall administrative or governance mechanisms of any country. Probably these are the three pillars which can, kind of help us have a shield against such menace in the present and in the future. Thank you so much, Dr. Garg. Now, may I come to the next round of a question, which again is kind of, we are again going, I mean, the intent of this our discussion is, what can we think that we've learned from the past going into the future? So, Sanjay, my question to you would be that, again, looking at the past and where we are now, what can be done ASAP, let's say, on US-India relations to help India prepare for the present, which itself is a challenge, and for the third wave? So, you're mute, sir.
Sorry, Ravinder. Your panel, you have amazing panelists who can probably say better. I can just give you some perspective of the discussion that we continue to have. Again, the United States is a great case point in what not to do, but also what to do. We've been through the maximum number of deaths, challenges, etc. But also, this is a country that was able to produce the vaccine in the record number of time in the history of the world, plus also the amount of vaccination, the speed of vaccination. So we've been on both spectrums, Ravinder. So there is a lot of learning of what not to do and what to do. One of the things that the United States did, and obviously Vipin and others who can talk a lot more about it, is the government made several bets on several companies, whether it was Moderna, Pfizer, AstraZeneca, Novavax, etc., because nobody knew whether Vipin was able to come up with or somebody else. And in a situation like this, you have to put your bets on a lot of people. That is what has worked well for this country. Again, I say this from lessons to be learned. That absolutely needs to happen. And looking at what has happened in terms of implementation of vaccinations also, it's been something. One of the things the United States did was enforce the Defense Production Act, which meant they can't export any of these things, because this was first Trump did it and then President Biden did it, etc. So again, I don't know the thing that was asked about the vaccine Maitri, etc. Those are questions that some of the other panelists can talk about. But I think the DPA was basically enacted that we have an emergency and we have to take care of our people first. So I think those were some of the things that were done. Now, obviously, as your panelist said, hindsight is 2020. But the past is a good indicator of what to do looking at the third wave. And the third wave, the worry, obviously, Ravinder, in talking to people in India, is that it is right now spreading rapidly in rural areas, which, as it is, have tremendous shortage of health infrastructure. You're talking about really very weak health infrastructure in the rural areas, as well as going into young people, etc. So those would be some of the things, that we should be looking at, Ravinder.
Thank you so much, Sanjay. Very interesting points, and absolutely. I mean, one of the learning points which you, I think, brought out, very, very important, very germane. I think that the US took a bet on some players, okay, and not knowing whichever would work out, and to take that bet. Here, I think or there in India, I think the government has kind of also loosened its purse strings, but not to the extent required, maybe, or not to the extent. I mean, they've allocated some budgets for the vaccine manufacturers and all, but there's some delays on that. There's some questions on that, some etc. So that I think is definitely, and to widen the net, to to spur more and more manufacturing. Though they've opened up now more research labs, I think, for vaccine manufacturing. That in itself is a question. But another point that you brought out, Sanjay, is about that rural areas and weak infrastructure in the rural areas, and also affecting the young. And to top it, now there's this talk, and we are seeing it, the so-called black fungus. So these are huge challenges which India is facing right now. As it goes on, what we could call as maybe the third wave, or maybe it'll continue as such. May I now invite, okay, we do have some comments coming in, of course. Subhash Chandra Pandey is saying, very true. Thank you so much, Subhash. Vikram is saying, Dr. Daswal, as we all know, different countries are having different varieties of viruses, and an infected person with one virus going country with different may contract new strain. Yeah, the mutation process and all. And that's why I think human behavior is becoming a huge concern out there. Thank you so much, Vikramji, for your thoughts and comments. May I now come to Dr. Kamil? Again, the context, but to set off the opening question for you in this sense, lessons learned, what can be done ASAP, and now given the context of the challenges that India is facing, we all understand, especially the weak infrastructure in rural areas, insufficient supply of vaccines or distribution of vaccines, or how long would it take for the vaccines to be delivered, and your thoughts on that, please.
Well, I think that COVID-19 has really shown us that the world is more connected and interdependent. There's no one country that's first. I think the United States and Europe and wealthy countries that are having their cases come under control should be allocating doses of mRNA vaccines, of J&J vaccine, and getting it to places that need it, because our own country will suffer if India's economy is shut down. As far as so I think there need to be investments from wealthier countries into developing nations, lower middle income countries, to prevent the suffering, to prevent the economic loss, because it's in our own economic interest as Americans to make sure that India is okay. Secondly, I'd say, sadly, India is in a place where you probably have to shut down. But once the case numbers get under control, I think it's okay to leave your house, and people need to be able to go outside and know what's safe and what's not safe. So is it okay to wear a mask? Is it okay to take your mask off if you're outside in an uncrowded area? Yes, it probably is. Is it okay for your children to play outside with other kids as long as you're not indoors? Yes, it probably is. So the common people, need to understand where to put their energy to protect themselves and to keep the embers of the pandemic from surging into another giant wave. Because people have only so much energy to spend preventing infection. They still have to go buy food and cook for their family and take care of their children, take care of their loved ones. So we just need very, very accurate information given to the public in the rural areas as well. So I think there's a huge mission here, not just to get vaccine doses, but accurate information, simple, almost cartoon pamphlets, so that a common person who maybe doesn't have a very high level of education can understand how to protect themselves, how to protect their family, and where to spend their energy. I think that's going to be key.
Thank you so much, Dr. Jeremy. Before I come to Dr. Mirnali for her comments, we do have viewer Ranjit Singh saying, great speech. Thank you so much, Ranjit. Please come up with a question. Thanks for the appreciation, but questions are more fun. They allow us to kind of dig in more. Before I come to Dr. Mirnali, Dr. Jeremy, I have a quick follow-up question with you. If you can just answer it in 10 or 15 seconds. We've all been talking about vaccines and vaccines. What about treatment? If you can just give a 10-second overview, do you see any green shoots of treatments or cures for COVID out there somewhere?
Absolutely. So there's been some journalism about it. There's basically an oral form of remdesivir that's being developed by Merck. So I do see some green shoots in that area. The question will always be, what will the cost be? Who will have access to it? Will it be given out fairly? And I think you come back to those same problems of healthcare in the whole world. It's a failure in the United States. It's a failure probably in India as well. The poor never have access to the healthcare that they deserve as human beings.
Thank you. Thank you very much. Dr. Minali, now a bunch of these questions, I think, the thought or the conversation is heading towards is, of course, the challenges, which, if we can look, I mean, even the urban areas are themselves not sufficiently kind of, empowered right now to, combat this menace, but more so even the rural areas and the young. How do you see India being able to build its capacity on various terms, in terms of the physical infrastructure, but even the systems, the methods, how to prevent this growing into a huge wave? It's not only a wave, it's, I mean, a wave can be a small wave or a big wave, right? So how do we prevent that? What is your thought on that? And in terms of vaccines, also quickly a question: what do you make of Pfizer, for example? Because Pfizer has been talking to India, but you see, that's what's happening in this real world, right? Companies are negotiating with whatever perspectives they have. I mean, US is holding on to AstraZeneca. Now they're going to release, fair enough. But what about other vaccine manufacturers? Let's say, especially Pfizer, which they came to India. There were discussions which did not kind of, finalize. So where are we on such initiatives also, please?
Um, Yeah, my first comment would be a request to US to release AstraZeneca vaccines as soon as possible, because they're being stocked here and not being used, and they have immense use currently in India. And regarding the villages getting affected in India, I must say that I have been a proud Indian when it came to village level. Um, India being a very, very huge country, but we are so interconnected. That is why we have been able to deliver policies and programs faster than any other country. Let us start speaking right from, say, alma ata and primary health care, and India was one of the first countries which went ahead, adopted that, and primary health care became the forefront healthcare delivery system, and we have been doing like much better compared to other LMICs. And I was reading news, and currently, the message has penetrated very far and wide in India. It's not that Indian villagers are not aware what are the steps they need to take for prevention of COVID, how the necessity for vaccinations and other messages are penetrated very well. And now village communities are being formed everywhere, so that the villages can come together, discuss the problems, and also kind of a bridge between the villages and the administration and the higher levels of healthcare. So that is happening very fast. So that is the beauty of India's interconnected systems that serve us very well during crises like this. The spread of communication messaging in India is very, very fast. Unfortunately, the spread that works for spread of misinformation, disinformation, myths as well. But fortunately, the kind of vaccine hesitancy we observe in US is not there in India, because we have had this history of getting vaccinated against tropical diseases, and there is an implicit trust in the government regarding vaccination. So every child gets vaccinated in India, whosoever is born, without much hesitancy. And today I went to take early in the morning my second dose of Pfizer vaccine. And unfortunately, the center was almost empty. During my first dose, which was like 3 or 4 weeks back, there was a traffic jam to the vaccination center, and we are seeing the data in US that now the vaccine hesitancy is reaching even higher levels than it was like before, and that complacency is setting in, and DGWHO is calling it vaccine euphoria. That we have taken a shot and now we are safe and now we can do anything. And unfortunately, that kind of hesitancy is not there in India. So as soon as vaccines become available, the people are going to come forward. And right now also we see a lot of demand. The apps are crashing of the demand, and as soon as the vaccine supply is available, I think the Indians will be coming forward in huge numbers and getting vaccinated. And preventive behaviors, now there is a deeper discussion because we have suffered. We have learned the hard way. That is the unfortunate part. But I think that those kinds of behaviors are now going to stand us very well against, God forbid, if a third wave happens. So we have learned our lesson, although the bad day. And there was one question for me: is vaccination going to be a part of our life from now onwards? I think Dr. Garg and Dr. Kamil are better qualified to answer that question for the audience.
Thank you so much, Dr. Mirnalini. Absolutely appreciated. Yes, I mean, India has had a huge success like the polio campaign, right? We've reached that. But this pandemic, the scale and the intensity and the timelines at which it has moved, I think it seems it has totally overwhelmed India's public health infrastructure. In any case, our health infrastructure is not, of course, where we would want it, of course. There's a comment coming in from Sneh Kalgotra. She's saying, Dr. Mirnalini, your views are very well and clearly expressed. They should be helpful even to the common masses. Great listening to you. Thank you so much, Sneh. A pleasure. May I now come to Dr. Vipin Garg? Again, what can be done ASAP? We do recognize the challenges which are there. The government is doing whatever it can. Human behavior needs to change. All of us, maybe much better communication strategies have to be set forth. There's a shortage of vaccines, which are for multiple reasons. India is not able to get sufficient vaccines. That all being said, what do you think should be done right now? If you were, let's say, an advisor to the Health Council of India, what would you advise? 3 steps, concrete.
Excellent question. So listen, the answer is very obvious. We need to vaccinate as many people as we can, as fast as we can. That's the most efficient thing you can do in a pandemic, is to vaccinate people. You can, of course, ask people to change their behavior. So you start there, because that's another thing you can do right away. We can't build any more infrastructure overnight. We can't build more hospitals overnight. I mean, all the supplies, those things take longer in many ways. So I think the whole discussion about making sure that we can get more vaccines to India is very relevant. I think one of the things we should be asking is that what's the reason all these vaccines didn't reach India at the very beginning of the process? And I think there might be a situation where there was some sort of nationalism going on, where India wanted to be self-sufficient in terms of developing and manufacturing vaccines. I'm not sure about that, but I've heard about that. And that can actually affect if right from the very beginning, India had partnered with some of the companies, particularly with its having a ready manufacturing infrastructure, maybe things would have been different. Maybe Pfizer vaccine would have been made in India right now. Maybe J&J vaccine would have been made in India right now. So maybe there would have been many more candidates that we could have been stockpiling and manufacturing, and this vaccine crunch that the country is facing would not be as bad as it is right now. So there's no question the fastest way out of this pandemic, we've learned that in the US. I mean, if you take the same wave that the US had, that New York City had, back at the beginning of the pandemic, and you take it to India, it's going to be the same outcome. So the reason we have it under control here, and we are opening up our society, people are going out and are able to spend time without masks and go shopping and so on, is simple: vaccination. We've vaccinated nearly half of our population. In spite of vaccine hesitancy, if you vaccinate half of your population, you're going to stop the virus. You're going to slow down its spread, and you're going to slow down the disease. So that's what needs to be done. The question is, how do we get there? I think the Indian government, and the point has been made very excellently, that it is in the interest of the rest of the world to vaccinate every country, in particular India, because India is a supplier of so many of the pharmaceutical products. India, is the IT back infrastructure of the many US companies. Imagine if people everybody in India is locked down and they cannot work, that's going to have a tremendous impact on our economy across all of things that we don't even think of today. So it is in our interest. We need to figure out, how do we get these vaccines to India as quickly as possible, and how do we manufacture more vaccines in India than we're doing right now? There are no easy answers. As we talked about, there is this backlog of supply chain, but that needs to be accelerated as well, and different parts of the world can help in that. because you can make different pieces. Everything doesn't have to be made in one place. The different pieces can be made in different parts of the world and shipped to India. So I think it needs a coordinated effort across multiple governments and multiple government agencies around the world, and to figure out how to make vaccines available. It's not just India. Uh, South America is facing the same issue. Latin America is facing the same issue. There just isn't enough vaccine. So it is not going to be sufficient to just vaccinate people in US and Europe and say, well, everything is fine, is back to normal, because the virus, we're going to have another variant. And one of these days, we're going to have a variant if we don't stop the spread of the virus. One of these days, we are going to have a variant that's going to break through the current vaccines. In other words, people who are vaccinated with current vaccines may not be as protected as we think they are. And then we might have a third wave all over the world, not just in India. So let's keep that in mind, that it's critical that we vaccinate as many people as we can, as quickly as we can, and the whole world needs to work together to make that happen.
Thank you so much, Dr. Garg, for your thoughts. I think the key message from you and the takeaway from this panel would be, I think one is vaccinate, 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 and all hands on board, all energy, all efforts towards vaccinating, and along with it, of course, the infrastructure to deliver the vaccines. I mean, so the whole aspect out there. Thank you so much, Dr. Garg. Meanwhile, a comment coming in from Dr. Gupta: the world, the experts are ready to help people of India only if, the big if, the tops in the government of India are ready to listen, accept, and work with the world. Thank you so much, Dr. Gupta. And yes, things are not as simple as that. There are too many wheels within wheels, so to say, out there. Thank you so much, Dr. Gupta. Now we move to the last and the concluding round of the panel discussion of today. May I invite Sanjay for your closing comments, please, on the topic of the day today. In fact, what you mentioned, Sanjay, earlier, I think that those are the kind of things India maybe needs to look at, something like a wartime authority. This is war. I mean, other than the fact that Defense Production Act, which the US kind of, invoked, this is war right now. But any which way, Sanjay, your concluding thoughts to wrap up this discussion. And Dr. Vipin Garg, I do know that you have to leave very soon. Your daughter is graduating today. So maybe if you can be with us till the concluding round a few more minutes. Could you do that, Dr. Garg?
Yes,
Thank
absolutely.
you. Thank you. Sure.
Well,
Sanjay, your concluding thoughts, please.
Thank you. I'll keep it very short, keeping Vipin's amazing daughter in mind. I think these comments have been made about vaccination. The comments have been made about people's behavior. So as far as vaccination are concerned, I agree with all the panelists. The United States, Europe, and others who have ready supplies of vaccine should release them to the world. I do know in our conversations that June is where, from what we have heard from the administration, they will release the AstraZeneca vaccines. We are trying to get an exact date, but we've been told next month those vaccines will be released. We also have a lot of surplus vaccines, Ravinder. When I talk to a lot of my doctor friends, they say, I've got so many vaccines sitting in my refrigerator, etc. So something needs to be done, because all that is also getting wasted. So we are working through a lot of these efforts to see how, and it's not India specific. I think, Dr. Camille mentioned it's Latin America, it's Vipin mentioned it's South America, it's Africa. All those places, they're going to wait till 2023 to get vaccinated unless we do some real major efforts. So I think it's incumbent upon United States and other countries who are in a better position, because we are all in this together. So we are working aggressively towards that. The supplies are also going to be released next month. There is more USAID aid coming in. There's more private sector help coming in. But also there's a lot of coordination happening in terms of lessons learned, etc. Now, as far as the War Powers Act in India, only India can speak to that. I was just reflecting, the DPA was enacted because it was like a war kind of an effort in this country. And as far as India is concerned, we all have families that are impacted by this. And really, our best wishes are for everybody in India, because it's easy for me to sit here in Washington and say these things, but there's a lot that is going on for everybody out there. So our prayers are all with them, Ravinder. So thank you for having me.
Thank you so much, Sanjay. As you were concluding, there's a comment coming in from a viewer, Jatinder Singh, which kind of echoes to what you're saying, that I pray to God that the third wave does not come onto the whole world. Absolutely, yes. I mean, prayers and thoughts are there, but along with it, it seems that humankind has to do some lifting on its own also, right? So that's where the challenge for all of us is. Thank you so much, Sanjay, for sharing what you learned on the hill and in a discussion with government officials. I'm sure that you'll take some of the takeaways from this meeting, this session's discussions, what Dr. Jeremy said, what Dr. Darswal said, and what Dr. Garg said. And you could, you will talk more forcefully with the decision makers or whichever stakeholders you can connect and are holding ongoing discussions with to kind of accelerate US India cooperation in this arena. Thanks so much, Sanjay. May I now come to Dr. Jeremy Kamil for your concluding thoughts, sir?
Yeah, well, I just speaking generally, if you want to stick to the topic, I think the United States needs to learn from its own failures and also what's going on, how we have not done enough for India, how we have not done enough for South America, for Africa, because we have to understand, like the wealthy, even within one country, our health depends of the educated classes, of the wealthy classes, also depends on the poor being healthy. Because if people are not growing food and farming and doing the things that serve the people who have more, then the whole society collapses. And the world works that way too. So I think in the future, I hope we're doing more genomic surveillance. Just that means sequencing viruses, knowing what viruses are circulating, and not just in wealthy people who have health insurance who go to the hospital. What's happening in the poorer areas, and how can you get poor people who have less money, who have less education, to trust the government, to trust health workers, to give them samples so that I guess vaccine hesitancy is not a big problem in India. It is a big problem here. But I think globally we have to learn from all these small examples and implement them, learn locally, get trust locally, and then bring those lessons back to the center, and then have people in government not try to control everything. You have to give power back to decentralized power, decentralized competence, so that vaccines can be made everywhere. We're not going to fix, like Dr. Garg said, we're not going to fix this pandemic by building vaccine factories overnight. But how do we learn lessons from this so that all of this suffering and loss of life is not in vain? How do we build a better, fairer, healthier world where everyone is wealthier, where everyone is healthier? And I think that is possible. We have the technology for it, but do we have the heart, and do we have the logic to realize that our fate is connected to your fate?
Thank you so much, Dr. Jeremy. Absolutely local in terms of, what's happening on the local and delivery on the local and improving the local per se. And in fact, that's also been one of the criticisms of India's policy, that there's too much centralization going on, in the overall sense that the central government, in its efforts to try and do its best, has ended up centralizing or trying to think that it can centralize decision making all through, which throws up its own different challenges. So that's an absolute challenge out there. Thank you so much, Dr. Jeremy. May I now come to Dr. Mrinalini for your concluding thoughts, please, on the topic of the day.
Dr. Kamil has concluded very, very beautifully, and I totally echo him in saying that this is the time when the world needs to think as a family and collaborate. And I repeat myself and also echo Dr. Garg in saying we are safe only when everybody else is. And regarding India's context, since we have among our viewers people who have been living outside India for a very long time, I just want to say 2 or 3 things. My own family has suffered, my friends and their families. There's a tremendous loss. There's a tremendous sadness and sorrow right now. And our hearts and minds and souls are with all of them who have suffered during the current wave. At the same time, I want to tell my brothers and sisters here that we have been building up our infrastructure over the past some years. I may mention, we have been looking at socio-environmental factors of health, and very fortunately, Government of India's focus, has been on these primary factors of well-being and health rather than tertiary care, which we see collapses very, very fast during an emergency. So there, we started the largest, healthcare insurance scheme, Ayushman Bharat, over the past few years, which has again served poor people very well during this pandemic. The treatment of entire families is free in any hospital across the country. And this is the first time people are availing this scheme, and I am very sure that people are getting helped. We did Swachh Bharat. We tried to clean up because we knew the determinants of the disease were there in the environment. India is one of the lowest carbon emitting country which is committed to environmental health, despite our size. And despite our progress, and we built so many new hospitals. Almost every state is getting this research center called as AIMS, which is designed on the same pattern as Delhi's AIMS. So no other government thought about all of these things previously. Like I said, we were preparing for a better and healthy India for some years now. Unfortunately, this catastrophe befell us at a very, very unfortunate time. Like Dr. Garg was mentioning, the timing was just awfully wrong. We were completely, in preparation for kind of meeting the next wave in our, the best in the best manner. And unfortunately, that could not happen. But all this preparation is not going to go to waste. We are going to contain this wave very soon. That is already happening. We are going to be much better at preventing the next wave. And India is there for all the other countries of the world for collaboration, for sharing technology, for therapeutics, diagnostics. We remember the AIDS epidemic and our contribution to
Dr.
that.
Medani, much appreciated. I think the larger context of where India is and has been doing a stupendous job. Absolutely sure. But I think the context of the topic today, and we are seeing it all around us, there are challenges. Vaccines are not reaching. Hospitals are, we are getting reports and we are seeing visuals where people are not getting beds in hospitals. So those challenges are there. So, what would you think, one or two things quickly, which you think the government of India could do, which could bring practical succor, relief right now?
I can. I would say I can make the recommendation for Dr. Puri currently, because I just heard him how he was trying to help us. So that effort needs to be ramped up. The vaccines need to reach India fast. And the raw material for making vaccines, India can make like so many more vaccines if we get the raw material. That needs to reach India fast. Also, the Friends of India, like India Caucus in the Congress, they need to like stamp a little bit ramp up, their advocacy for reaching diagnostics and tests, and we have to, expedite the TRIPS waiver and all of those things. But the thing of immediate concern is to reach as many vaccines and raw material to India as possible. And then we are very intent on vaccinating our entire population as soon as possible. So that kind of collaboration, India has intent. India has the wherewithal. India doesn't have the supplies right now, and that is where we need help. And thank you, Sanjay ji, for thinking about us in this critical time.
Great. Thank you very much. Sanjay, maybe I'll come to you for the concluding remarks, but let's take it from Dr. Vipin Garg for his last remark, because I think he has to run in order to keep time for his daughter's graduation. Dr. Garg, your concluding thoughts, please. And then I'll come to Sanjay for your conclusion, please.
Yes, thank you. Well, first of all, let me thank you and the fellow panelists for an excellent discussion this afternoon. For me, I'll keep it really short. For me, there are really four things that come to mind that we need to focus on, both for right now, right here and right now, as well as for the future. So goes without saying, the first thing we need to do is figure out how to get vaccines, how to get the vaccine supply up and vaccine delivery. And there are many components that go into that, and we need to work with the people around the world to make that happen. We also need to focus on educating people. I think it's been discussed that it's really important that we teach people how to, they can change their behavior in order to affect the pandemic. So there needs to be more focus on that in India, but around the world. Everybody needs to be reminded how to fight a pandemic. And the rules are not very different. The good news is if you learn the tricks once, you will always be able to use them in the future as well. We also need to invest in infrastructure. And one of the things I worry about that once this pandemic is gone, we'll all be complacent again. We'll say, well, that's it. It's gone. Nothing is never going to happen again. And we're going to have the same thing all over again when the next pandemic happens. So we've got to all remember, once this pandemic is over, and it will be over, that we keep reminding ourselves, we keep reminding our governments, our federal agencies, that we need to continue to invest in infrastructure. And finally, I would say that we need to invest in science. We need to continue to understand how the virus is changing and how the vaccines works. What's the durability of these vaccines? How is the protection going to work against variants and transmission? And finally, we need to continue to invest in new vaccine technologies. We need better vaccines. In spite of the fact that we have great vaccines, we need vaccines that are room temperature stable, that can be delivered more easily to rural parts of the world. So there are many other layers of vaccination. It's not just the efficacy of the vaccine that's important, but there are many other components of the vaccine that are important for an effective vaccination campaign that we can't lose sight of. That's part of the reason it's been difficult to vaccinate people in India, because the first generation vaccines, they have to be stored at -20 or -80, and that infrastructure just isn't as much available in India as it is in the US. So we need to think about that. How can we have vaccines that can be delivered all over the world, in rural parts of the world, and can be easily administered if that's possible? So I would stop at that.
Thank you so much, Dr. Garg, for your concluding remarks. Absolutely, as vaccines and the appropriateness and also the logistics, the supply, the storage and distribution and all of those points, getting it there, and the focus on science, good science. If I may, I'll just add to it. You are a scientist, but my focus would also be treatment, cure. Sure, vaccines are there, but I'm trying to keep an eye out, and we are looking out, where could be some hopes for treatment or cures, which are proven. So hoping that folks, good researchers and entrepreneurs like you, like Dr. Jeremy, can come up with more and more good science, which reaches more and more across the planet. Thank you so much. Thank you so much, Dr. Garg. You may please proceed if you may want to now. We will shortly be concluding. Meanwhile, we have some comments coming in from Dr. Gupta again saying, yes, before the hurricane comes, we prepare for the damage before, not after the hurricane comes. Simply, India did not see the tsunami coming. Thank you so much, Dr. Gupta. There's a comment from Bharat Bhushan saying, interesting discussion, keep it up. Thank you so much, Bharat Bhushan. Now, before I come to my colleague Sanjay for the concluding remarks, Dr. Jeremy, you had one round of conclusion, but if you would want to share anything else in the next 15-20 seconds before I come to Sanjay, please.
Sure. I thought what Dr. Garg said was, I would echo everything he said, the trust in science. And I also think it's so important that India has its own competency. And one thing, I think someone in the comments said it was like a hurricane or a typhoon slamming into us that we didn't see. And the way you prevent that is something called genomic surveillance. And Dr. Rick Bright from the United States, he's now a vice president of pandemic preparedness at the Rockefeller Foundation. And he said very clearly in interviews in Nature magazine how this should really be like a weather system. If we build competency in rural areas and throughout different states of India and different states of the United States, poor countries, rich countries, we should be sequencing all the time the things that make us sick, even in people who don't feel sick, so that we have almost a radar system so we can detect the next pandemic when it's in its infancy and smush it like a bug before it spreads everywhere. We can know what it looks like. We can give vaccine manufacturers the data. But for that to work, the incentives need to be there. And that's where we can use the help from government and leaders like you to figure out, how do you incentivize that sequencing? How do you keep the ownership local so that people have an interest in sharing in real time the data that comes out of human being samples? How do you get the trust from poor communities to give doctors, to give people in their own communities those samples? And if you do this correctly, there'll be a lot of new jobs, a lot of great places for people to use their computer coding talent to mine the information, and a lot of things that India can be proud of and rural areas can be proud of for contributing this important data that keeps us secure from the next pandemic. And so I thought what Dr. Garg said was so important. We cannot let our guard down, because this pandemic will pass and we will win. But will we fail in the end to keep the investments up, to build something sustainable to protect us, to have a guard system, a radar system for the next one? I think that's a critical lesson that we hopefully will learn from this. Decentralization, sequencing, and coming up with the right incentives to keep the information flowing in real time about all the microbes that plague us. Antibiotic-resistant bacteria, a lot of threats on the horizon, crop diseases, a lot of things that could threaten our food security are microbial as well. So we have these technologies, but they're not in place yet to protect us. And I don't want a next crisis that could have been prevented.
Thank you so much, Dr. Kamil. I think you laid out and mentioned what really must be, something that we need to do, governments need to do, and be it PPP or public-private partnerships or whichever partnership for formats could be there, because it will take everyone, all stakeholders, to work together. No one pillar of society would be able to kind of carry this burden all alone on one shoulder. Thank you so much, Dr. Kamil. We've had some more comments coming in from Mr. Rakeshwar Singh Darswal, saying thanks to all of you for such a wonderful discussion and valuable views. Thank you so much, Mr. Rakeshwar Singh, for listening in, joining in. It's always a pleasure to have folks, and that's the intent of us hosting these weekly or fortnightly programs, that we want more and more to be able to, at least the least we can do is to be a platform for folks to share ideas and views to build up a community. Thank you so much, Mr. Rakeshwar Singh. We also have a comment coming from Jatinder Singh. God save the whole world. Thank you so much, Jatinder Singh ji. Now, may I invite Sanjay? Sanjay, are you there, sir? Your video seems to have. Oh, yeah, welcome. Sanjay, may I invite you for your concluding thoughts before we close the broadcast? And I think there were some discussion points which Dr. Mrinalini mentioned about, advocating with the caucus and such on the Hill, which perhaps you would absolutely be most rightly placed to address or share. Please.
Yeah, sure. Ravinder, I'll make it a little brief because my laptop's running out of battery. It's a different kind of challenge rather than the pandemic. But I think Dr. Mrinalini said right. All of them have said right. There is a responsibility for all nations who are in a position to help, because this is a joint challenge we all face. We are working very diligently, very rigorously on a regular basis with the caucus. We're working with the administration to make sure that India gets the vaccines in time, they get the supplies in time. So our commitment is to make sure we do that. We're also working on creating a doctors network that the patients there can reach out to here, as well as seeing if there are some surplus other supplies like PPE, etc., that can be donated out there. So that work is going on. The India caucus is keyed in on there. The Indian embassy is working with them. So there's a high level of engagement, and I can tell you this administration is very focused on doing that, Ravinder. So USINPAC is really engaged on doing this. Thanks, Ravinder.
Thank you, Sanjay. May I thank our esteemed panel for the day today. Dr. Jeremy Kamil, thank you so much, sir, for your thoughts and clarity that you brought to the question, especially your point when you're repeatedly saying that we should be tracking more and more the microbes or whatever. I don't know the technical terminology, as you're saying, on the local levels, what is mutating, what's out there, and along with it, the associated infrastructure and all, because humanity has to track, we have to track what's happening with nature around us. Thank you so much, Dr. Kamil, for your thoughts. Thank you so much, Dr. Mrinalini Darswal, for your thoughts, especially with regards to, how the robustness, though it's under challenge in India, the robustness of a public infrastructure, which can, help us tide over this pandemic. Definitely, India's challenges are huge. Things have been done, but a lot more needs to be done. Thank you for your thoughts so much therein. Thank you so much, Sanjay, for your thoughts and joining us and sharing with us the discussions and the takeaways from your meetings last week on Capitol Hill with members of with members out there on the Capitol Hill, so to say. Thank you so much, Sanjay. Thank you so much to the viewers who joined in. Thank you so much to the USINPAC team. Santino, our Director for Government Affairs, Mr. Prasoon Sharma, who's my remote producer out here, our colleagues Dolly Kapoor, Vikram Chauhan, who all helped to put this program together. Till the next time now, this broadcast ends today. Thank you so much. Signing off.